Hello, my friends. It's my honor to share our topic here. I'm Dr. Chang. My topic is the novel stereotaxic laser runner system for neurosurgical intervention. Thanks to Professor Kee Park of the Harvard University for his recommendations, and thanks to the invitation of SCMC, I and Dr. Tang Dan are two neurosurgeons from China. We are living here, the Hunan province, where Chairman Mao born here. Like the world, there are also huge economic differences among China's regions. We are in the middle advanced status, and to the sea it advanced here and disadvanced here. So we have seen many hospitals. We want to the surgery to be more easier and affordable, like what SpaceX do or in the future. As we all know, there are 5 billion people have no service of surgeries, so normal technology are the key factors in the realization of the goal to scale up and strengthen surgical care worldwide by 2030. That was the recent one said. And the burr hole is the only operation of neurosurgery in 44 essential operations by World Bank. So we think to realize the global neurosurgery, the frontal innovation is most important. So we should communicate and cooperate to realize that. The key question of this topic is how to locate deep lesions in the brain anytime and anywhere. I know there are many devices to do that, like the stereotaxic frame, which was invented nearly 80 years, and the robot, which was invented about 40 years, but they are far from popularities. Most doctors still rely on their skills and knowledge to do this work. So the popularity of the location device or technologies relies on how it can do the accuracy, and it will be obstacled by the price and the convenience. We think the guided surgery can resolve most of the problems, and we invented some new guiding ways, like the laser frame, the laser ruler system. We call it, and it's like augmented reality. It's used laser plane restore the coordinates of CT or MRI. It needs no icons. And another one is the software or the digital twins. Just use the DICOM document, put that into the computer and reconstruct the patient's head to do the locations, and all these two methods can result in the guided MRS. This is the laser ruler system. In the operation room, we input the parameter of the CT to the software and to the apps, and to get the reference line and the target line, and then mark the 4 points on the skins of the patient. Fixation the head and use the laser frame. It can rotate and move as well as you can to restore the CT scan. That is the reference plane. Then we go to the target plane. So it is the target plane. It's this section. And in this section of the CT, we load the coordinates of X and Y. So do that in the laser ruler. First, to determine the X, so we got the X. Actually, we do both sides to make it more accurate. Then the Y value, the lateral access of the laser system just down to the depth. This is a key discipline of the method. You can see whatever the rotate of the laser, once the axis of the lasers aim at the target, the intersection of the two plane of the laser, always the blue one, the blue line, always pass through the target. So, back into the patient. Mark the 3 points. Rotate the laser across the entrance point. That is entrance point. We cannot see actually the laser plane in the space, so we use the guide to record it. This is a guider. Adjust the guider to match the intersection of the two laser plane. This is a trajectory. Mark the 3 feet. And as to the depth, only rotate the laser. And we got two equal triangle. The depth is here, so the depth we can know. So we finish the location period. To record this parameter and disinfection the patient, use Stereotaxis to copy the parameter. Put that to the 3 feet back to the 3 point and do the guided MIS. It's a real operation. It's a hematoma, and we got at least as a target point. And to get coordinates, first we can make the margin, make the edge of the X and the Y, and measure that in the screen. This is from the left side, the X1. That is X2. From the right side, the edge of the right side, and from the eye, the Y1. Put the 4 points, eye, ear into and target the location into the apps, and we got the reference line. Mark the 4 points of the reference line on the skin. Adjust the head to make the 4 points the plane more vertical to the plane, and use air clips to determine the luteal head position to make it to know or decrease the mistakes. Line up the base plane or the reference line of the lasers to match that to the 4 points to get the reference, reference plane. To check. Okay, and this is a target plane. To check the plane and do the X1, that is from the left side to right one is X1. As to X2 from the right side, the edge of the right side is matched, so the mistakes is minus. So X was done. Then to Y, the Y value. Use a little laser system That is a laser. The lateral laser down to the depth of the Y1 and get a point. The lateral projector point, that is entrance point. Rotate the two laser to cross this point and assembly the primer to record the puncture direction, that is the intersection of the two laser plane. Record position of the primer, the feet point on the scar. And measure the depth. Record all these parameters and do routine disinfection. Use the guider to guide the incision of the skin and the burr hole and the puncture. Puncture the hematoma to the predetermined depth. And suck a small amount of the hematoma. Surgery was done. For hospitals, you can get the DICOM files. We suggest you can use the soft one, that's a digital twins for MMS. Put the DICOM files into the computer and automatically create a digital head of the lesion and segmental of the lesions, that is a hematoma. You can and the video guide primer pass. You can see from each angle so that is a vertical plane and reality restoration. How to do that? First, you can adjust the object guide parameter according to the plan. This is the computer, and that is well one, and you can know the depths. First, the most question is how to restore the location. Just use the chord length method. You can see here the 2 points can determine this point, and use this method you can determine the 3 points of the feet and to the real location, that is a mark of the feet, and the stereo guided puncture, that is digital twins for MMS. And this is a real operation. Before the operation, there is hematoma in the left side, and the pre-surgical plan, and to recheck before the operation. Use the CMA to recheck, and keep it guided to drill, and just enlarge the all this surgery was finished in half an hour. It's very convenient. And sucks a small amount of blood after the CT after the surgery. So in the soft one, we have 3 steps. Before the operation, we can do the surgical plan anywhere and anytime, even at home or in the train, something like that, and only use the computer, but you must have the DICOM files. As to step 2, and you must restore the locations that mark the foot points and copy the guider like this. So you have the marks and the guiders. When do the operation? That's step 3. We restore the stereo one to copy the parameter and put that onto the head to check if the 4 points match the 4 points, and do the drill and enlarge the hole and do the puncture and suction a small amount of the hematoma, and that is after the CT after the operation. We can use several times of the eucalyptus and to help to resolve this hematoma. There are great benefits of the soft one. You can see if the first trajectory we planned is here, and you can see that clearly there is a middle meningeal artery here is very dangerous. So we change that point to this one to go to the back one and still get good result. There are some cases. One is phalanx hematoma only 7 millimeters, but the patient's symptom is very severe. So we do the surgery and it's very quickly. As for abscess, it's very rare in China now, but this abscess is complicated. You can see there's a vein just on this, and there are 2 abscesses connected. So we plan to do the tendon puncture. It's in the operation like this, and you can see after surgery, before and after, the location is very good. This is another interesting operation. That is, you can see the shrapnels in both sides of the brain, and we do pre-operation plan like this from each side to withdraw each shrapnel. This hospital is very famous for the gum wound in China, but this time they use the guide to do the surgeries. They only use nearly 2 hours to do both sides. It's much faster than they think. Then they once used another techniques to do that. So they are very satisfied. We have published some articles, something like this, in the World Neurosurgery or other magazines. We still get some lecture in the interventional meetings, and some Dr. Shakirs in Tanzania come to our city to learn these techniques. We still have many other products or technology, and why we really want to share all our thoughts, and we communicate and make good futures. Thank you all.